Hello and welcome to another episode of our Brothers Creed podcast, where we talk about motivation, experiences, and we explore the world around us. We are the Thomas Brothers, and I'm Jared.
And I'm Ethan. And today we're going to be talking about non-traditional therapies. So there's obviously lots of medical conditions out there that people suffer with every single day. And there's also a wide variety of cures, of things that will relieve symptoms or therapies or something that claims to improve someone's either health or physical or mental situation.
Yeah.
So today we're going to be talking about some of these weird kind of non-traditional therapies that have happened in the past, as well as current ones that are still active today. And maybe they work. Maybe they don't. I don't know. We'll talk through some of that.
All right, let's do it.
Yeah, I'm thinking I'm back.
Most valuable commodity I know of is information.
And that, my friends, is called integrity. That's called courage. Now that's the stuff leaders should be made of.
Either you're somebody or you're nobody.
You're not the devil. You're practice.
Okay, so some of these therapies, I know that you had kind of pulled some from past, pulled some from current. Both of mine are kind of more modern. Actually, I have two, and then some smaller ones that are more modern. But I know you've got some from ancient days. So let's start long ago.
Yeah. So I was kind of interested in this. Whenever I heard these therapies, the first thing that popped into my head was like old wives' tales, like things that you say, oh, well, I'm sick, and people say, oh, well, you need to go, do this or do
bathe
that
in the
or,
river.
oh, I have water in my ear. Oh, well, you need to jump up,
drink a cup upside down.
Yeah, I have the hiccups. Oh, you need to drink a cup upside down, or you need to jump up and down and hold your breath for 2 minutes and do this. It's like, all these different kind of weird things.
Yeah.
And I spent a couple years in Chile, in South America, and it's just different culture, right? There's all these kind of weird things that people say are going to happen to you if you are exposed to different things. One of those things that I always thought was kind of weird is that if you go and somebody is you knock on somebody's door, and if it's like a little bit brisk outside, then the person that answers the door, if they were ironing in the house, like if they were ironing a shirt, and at least where I was, they didn't have like clothes dryers. They would just hang dry everything, and then they would iron it. So there's a lot of ironing. Supposedly, if you iron and then you open the door to your house and it's like brisk outside, and if that cold air hits your mouth, then in your face, then your whole face will go crooked and seize up. And so people would come to the door and they would cover their mouths when they would talk to you. And you're like, why are you covering your mouth? And like, oh, I don't want my mouth to go crooked and get stuck that way.
Oh gosh.
You're like, what? And like they're like, oh yeah, you should never iron with the door open or with the window open, because that'll make your mouth go crooked. So, that was one. Another one that somebody told me was that if you eat tomatoes and drink milk together, you would like instantly throw up.
Tomatoes and milk. You've never been sicker.
Yeah. Well, yeah, and I was like, yeah, and I go, man, I've washed down quite a few BLT sandwiches with a glass of milk, and I've never gotten sick because of it. Another one.
Well, you probably weren't drinking like straight from the cow milk,
Well, I guess. If right before you went to bed, if you had a glass of ice water, you'd wake up with a cold in the morning.
Oh.
So those are kind of some weird things. Interesting kind of like remedies, let's say, kind of therapies was if you were sick, you'd slice up onions and put slivers of onions in your socks whenever you go to sleep.
I've seen that, but with potatoes. I saw that.
Yeah,
Did
and
you
it
see
was
that?
it's supposed to draw out any kind of toxins and infirmities and stuff like that. I don't know. I never did it.
I saw this one thing. I was gonna say that's one of the ones I was gonna mention. I saw this thing on Instagram. Oh, I think it was TikTok. So who knows? But the lady, she sliced a potato She put it on her kid's foot, the kid's sock on, the kid was sick, and then she put one on her feet, and then she just left 2 slices out on the counter. And then like 3 hours later, she took the ones on her feet off, and they were just like white still. The one on the counter, 2 slices that were on the counter were just still white. And then she took the ones off her kid's feet, and they were like literally black. I'm like, what is going on? It's crazy, you know?
Yeah, I don't know. Another one was if you have a fever, like a high fever, you take egg whites and you put egg whites on your forehead and you let it dry, and that's supposed to kill your fever.
Yeah.
Which, I mean, I guess if it has kind of like a cooling type thing, you know, maybe it can kind of draw out. I don't know, but people, you know, they swear by it.
You kill a cat and drip its blood all over your body, and then you're like, oh yeah, I don't have chicken pox anymore.
Yeah, so some other kind of wives' tales that are kind of like theories, right, is that, and some of them might work, right, that eating carrots can improve your eyesight, which, yeah, maybe is true or not. They're rich in, you know, vitamin A and whatever they say, keratin, which can help you maintaining good eyesight. You need to eat chicken soup whenever you're sick or you have a cold. That's going to make you better. Like,
what do they say? Starve a fever, feed a cold.
Yeah. And then another one is drinking lemon water can boost your immune system. You know, maybe it does. Well, there's vitamin C in lemon.
Apple cider helps you lose weight.
Yeah. Ginger.
Apple cider vinegar it is, yeah.
Yeah, apple cider vinegar. Ginger can help with nausea. That's kind of one that's, well, maybe.
Yeah.
I don't know. I mean, and garlic can help lower your cholesterol is another one.
Onions help your testosterone. We talked about that.
Yeah, seriously. So those are kind of like, I guess those are within the category of, I guess, let's say true wives' tales, that have been like, they're like old sayings.
Yeah.
But there's been some science that have been like, well, yeah, these actually do kind of have the potential to do those things.
Yeah.
But then you have like fake wives' tales that are that have kind of been disproven, and one of them is cracking your knuckles can cause arthritis.
Oh yeah,
they say that has not been proven. That reading in low light or sitting too close to the TV can damage your eyes.
Well, one of the things I found is like it's difficult for them to do ethically to do experimentations on people.
That is true.
And so a lot of these therapies,
they don't stick a bunch of kids in front of the TV and see if it hurts their eyes.
We're going to put these kids 2 feet from the TV, and then we're going to put these kids 10 feet from the TV. And we're going to make them do that for 20 years, and we're going to see what their eyesight's different. You know, it's like, so it's unethical to do these. And then sometimes people will remember things differently or whatever. So it's really hard to actually control and do controlled experiments when you're dealing with human behavior and human health.
Yeah. Well, another one was that shaving your hair makes it grow back thicker.
Oh, yeah, I've heard that one.
They were saying that one's just freaking bogus.
That's why, like, a guy when I was in Mexico, he had hair, like, kind of like beard hair up on his cheeks, almost like right under his eyes. And I was like, and you could see where he would shave up to that, but he wouldn't shave it. I'm like, bro, you got to shave right here. And he's like, no, I don't want to shave that because then it'll grow back much thicker. And he wanted, like, hair growing, like, under his eye, you know? I was like, okay. Makes sense.
Yeah. So those are kind of some interesting ones that I kind of had put together. Kind of thinking of like, you know, old sayings, right? The old wives' tales.
Yeah, I remember when we did the Gladiator episode and they would put Gladiator sweat in like creams and stuff.
Yep.
That they would sell. Yeah. Well, I have did you have any from like ancient Rome? I thought you had one from. You want to do that one first?
I kind of went through. I kind of broke it into a couple different categories. So I did one is the Roman Empire, and then the Middle Ages, and then modern times. So just kind of going through some of the ones, and it's interesting how some of these are repeated, right? And so they were many strange, kind of unusual therapies believed to help your health and well-being during the Roman Empire. So one was sweat therapy or sweating therapy, which believes that the Romans believed that sweating could purify the body and promote good health. And so they did a lot with both saunas and different things, steam baths to promote sweating.
There's a lot of science behind that, man.
Yeah.
I actually just bought a sauna myself. Did I tell you that?
But they didn't know. I mean, they didn't know that. So And I'm not saying these therapies might be considered strange or unusual,
Yeah.
but that doesn't mean that they don't work. That they're
Yeah.
not effective.
Yeah.
Some of them might be, some of them might not be.
Yeah, exactly.
So another one that they did was urine therapy. They believed that urine had some interesting properties that could treat various ailments.
Necessary.
And and so that's actually one of the big ones that I dove into a little bit. So we'll talk about that one. Bloodletting.
Yep.
That was very popular.
That's why did Abe Lincoln die from bloodletting? Oh no, he
No,
got
I
shot in
think
the
it was
head.
George.
No, he got shot in the head. But
I think it was George Washington. They did. He was sick from a couple other things, but
Let too much
what I
blood
think
out.
actually killed him was a loss of blood from that. So mud and minerals. They did lots of mud baths. Snake therapy was one that they did. They believed that snakes had therapeutic properties, and they would use them to treat different illnesses like headaches and joint pain. And
how would they use that? The venom or something?
yeah, they would do anything from like eating them to like ingesting their venom to
Jeez.
like all different kinds of stuff, which is kind of interesting. Another aromatherapy, which is not, we do that today. And then another one is, I don't know specifically know how to pronounce this, but helminthotherapy. Basically, it is the belief that ingesting certain parasites, like in your body, swallowing certain parasites like tapeworms and other parasites, they thought that would improve your overall health, that they would go in and they would clean out your system and everything else. Which I don't know if eating tapeworms would be the best thing to do, but
bad. I would not want that. I heard about a bear hunter, who he killed a bear and he touched its face or something like that, and then he got like a brain worm or like some kind of thing in his brain, and then it ended up like paralyzing him for life.
Yeah, apparently bears are very, very parasitic, like really, really bad. So this one guy, was this hunter guy I was watching, he was like, I don't know why people would ever eat bear meat.
Oh yeah.
He was like, that stuff is so infested with worms and bacteria and everything else.
Jeez.
But I don't
Interesting.
know. Maybe.
Well, let me share one of my
okay.
more modern ones. So this one's called primal therapy. So this one actually was invented by a psychologist named Arthur.
By the Liver King?
No. By Arthur Janov.
Primals.
Yeah, exactly. Primal therapy is based on the idea that neurosis is the result of repressed childhood trauma. So the concept first was outlined in his book in 1970 called The Primal Scream. Primal Therapy, the Cure for Neurosis. So it was very popular in the 70s, and it was tied to kind of like this counterculture of the day, that was kind of it was very popular among celebrities. And basically when you ask like, well, what does it do? So the idea is that the best way to address that trauma that you have, is what the guy Janov argued, is through a patient recalling and reenacting the traumatic experience and expressing that repressed anger or frustration. And that's the key. So through spontaneous and unrestrained screams, hysteria, or violence. So not violence toward anybody particularly, but just like, just getting out that scream, or like, so let's say as a kid you were bullied or
smashing
like
pumpkins.
Yeah, so like the idea is that like you get your mental state back to then, and you just like release that trauma through screaming or like punching a pillow or just kind of a thing. He claimed in his book 80%, that's a pretty high number, of all ailments could be cured with primal therapy. The idea is that the repressed trauma over time becomes intensified, and the only way to get it out is to release it through screaming. So how do you do it? That's a question.
Well, maybe I won't say that. I was gonna say, man, there's a lot of social justice warriors out there, feminists out there that shouldn't have any ailments.
When Trump wins the presidency, yeah. No. So to resolve primal pain, Dr. Janov invited patients to regress to their childhood. His offices included cribs his offices included cribs and toys. Patients were permitted or encouraged to suck on their thumbs. Only once they have reached their former infant state might they access the primal pain that they had repressed. So he actually has like a retreat. I think that's still open today. It's like a resort somewhere, and you go there and you stay there for like 3 weeks, and you don't have any cell phones or coverage, and you eat the food that they give you, and then you kind of like get into this state, and then you just kind of scream out and stuff like that. And of course, the question is, well, does it work, right? And it's hard to tell because people that pay money to go do this or people that are doing this therapy, it's almost like, well, is it a self-fulfilling prophecy? You know, the testimonials that you'll hear are typically from people that really thought it worked. Typically, you don't hear testimonials from people who are like, yeah, it's absolutely baloney. Especially, well, I think that modern
Especially
times,
people that went and spent like $20,000 to do it. They're not going to be like, oh, that was a waste. They're like, oh, yeah.
I think that in modern times, sometimes non-flattering testimonials can go more viral, like on TikTok and Instagram. But previously that didn't exist in the 70s, and it's difficult to avoid the placebo effect, like I said earlier. And when someone cries and punches a pillow or screams, it can be cathartic, and it can release endorphins, and it almost gives you like a runner's high. And this can be perceived as the therapy working, but that wears off. Moments, it's only temporary. And so it's just an interesting thing. I remember watching one of those movies, the show Alone.
Yep.
Where they go out in the woods and they just spend time in the woods. So one of the guys, he would just, I thought it was always interesting that he would just go in the woods and he's like, I'd just scream and yell and, cry and all this kind of stuff. And he was like, being out here has brought me so much more closer to my emotions because I have no societal pretext to mask my emotions. He's like, if I'm feeling sad, I'll be sad. He's like, if I'm feeling mad, I'll yell. And he was kind of talking about how it really like kind of balanced him and brought like a interesting peace.
There's no one to judge my emotions.
Yeah.
Like,
and because
however I feel, I'm going to show it, and nobody's going to be like, oh, he's mad or he's whatever, or you're this.
Yeah. And by letting
sense.
it out, by screaming, letting it out, it like helps with that. So, I mean, how many times at work you're like, oh my gosh, this guy freaking doesn't get it. Like you're like just frustrated with talking to someone, or you're like frustrated with a project. I mean, I do a mom sigh. So if I'm working in my office and I'm like this, like I'm just like, she's like, you're doing the sigh thing that your mom does when it's just like, like, well, I can't get this, or like this is not working, And anyway, maybe I need to be a little bit more primal than that. Like, I just start screaming my head off, Anyway, that's the therapy. That's the interesting therapy.
I saw this TikTok, and it was like, what do you do for therapy? And it was like, I play video games. And then it like panned over to this guy playing video games, and he was just like yelling curse words at the TV. He was just like, what the heck is this?
Yeah.
Blah, blah, blah. And they're like, oh, it's your therapy?
Or going to roll. Yeah. Dude, side story. So, jiu-jitsu can be violence. You can let out some of that primal therapy.
Yeah.
So there's this guy visiting the gym last night, the jiu-jitsu gym I go to, and he was a purple belt, and he was just like, oh yeah, I'm just visiting. We're doing some stand-up takedowns. The first takedown, he was going to go up against this one guy, probably one of the best guys in our gym, and he literally, we're just doing 1 minute rounds. It was the first guy to go, the first thing, and he blows the dude's knee out. Had to call an ambulance, all this kind of stuff.
The new guy blew your normal guy's knee out.
My gym, doesn't have like a lot of like high level belts. So the new guy blew out a white belt's knee in less than a minute.
Oh,
and he's like, the guy was like, oh my gosh, my knee, I feel like it just tore my entire knee. I heard a pop. I rolled it outside of his knee. He thought that he was like, my knee was so hot. The guy who blew out his knee, he's like, I thought that like my blood was running down my leg. He thought he broke his leg and like blood was gushing down his leg because he's like, it got so hot after I like did that. And he was like, dude, this is bad. He's like, call an ambulance. And I was like, we were all like, oh geez, I'm not going up against that guy, dude. And obviously he felt super bad, purple belt, coming.
Was it like a risky move, or was it just
Well,
like
he
one of
just-
those freak accidents? I mean,
It was an accident, but the way that he took him down, just kind of, he isolated one of his legs, and then kind of the way that he made him fall was just, he fell inside and he just really rolled out on his knee. I think he dislocated his knee, that it might have come back in, which I think is what happened to me when I was in that tournament. But anyway,
yeah,
that's kind of crazy.
interesting. So yeah, that's primal therapy. Okay. Well,
Yeah.
I mean,
Hey, man.
there's some decent facts on it, maybe. So there was, I looked up too some interesting therapies from the Middle Ages, and I'll just kind of pinpoint out a couple of these. Actually, some of them were very similar to the Roman Empire. They had bloodletting. That was also one. In combination with leech therapy.
Mm-hmm.
Urine drinking was another one.
Mm-hmm.
Trepanation, which is a surgical procedure where a hole is drilled into the skull to release the evil spirits that cause illness.
Oh, or like skull pressure?
Yeah, I guess. I don't know,
Interesting,
but it
yeah.
was that would it would release the evil spirits that cause illness. So they just drill a hole in your skull to release the demons, I guess.
That's like a lobotomy or something.
And this is in like the Middle Ages, right? So they would also do something called mummy powder. So they
would crunch up mummies, right? And they would eat it.
Yeah, they would grind up mummies, and they would grind them up into a powder, and they would use that powder to cure different ailments, whether they were going to ingest it or put it into creams or whatever else. But it's just like literally ground up mummies,
Cringe.
which was kind of interesting. And then another thing they would do for pregnancy tests, they would take the woman's urine that thought that was pregnant, or that if they thought she was pregnant, and they would drop a needle into it, and if the needle floated, then she was pregnant, and if it sank, then she was not. I feel like that'd be a pretty easy test to try to replicate, but
well, I mean, that's how they tell nowadays if you have progesterone in your urine, basically,
yeah,
right?
certain things. So that was interesting.
Is it progesterone? I think it's, I don't know. If you have certain, no, it's like a certain thing that it's like only you definitely have it if you're pregnant, but you definitely don't. So you normally would have progesterone, if you're not pregnant, but it's like, yeah, anyway.
So one of the ones that I dug into a little bit further, all of those are just kind of high level stuff, but I dug into, because I just had a hard time with this one, urine therapy.
Okay.
Also known as urotherapy.
Mm-hmm. Sounds
Basically,
a little bit more palatable.
Yeah, it's an alternative medicine that involves using one's own urine for therapeutic purposes, such as drinking, topical application, or irrigation.
Irrigation. What do you mean
so
by irrigation?
Irrigation is, for example, ear infections, or if you had infections of your eye or something like that. Basically,
like washing it out with.
It was used as like, I mean, potentially it's just like a saline solution,
like
right?
Wash your sinuses out with.
It's a sterile saline solution,
yeah,
basically, and so they would use it as irrigation for different things in your body. So I kind of looked up what are some different things that urine therapy claims to correct or claims to help with.
Yeah,
and then how do you utilize the urine to help with that specific thing?
Okay.
And so there's a couple different, there's like kind of 10 main things that it supposedly helps with. And there's like huge disclaimers on all of this, because there's like no scientific evidence that supports any of these claims that using your urine, it's not a recognized kind of like valid medical treatment. So
this is a pseudoscience, I guess.
Yeah. So proceed at your own risk, I'll say. So the first one is acne and other skin conditions. Urine can be applied directly to the skin to help improve the appearance of acne, or it can be used as an irrigation for other skin conditions. Supposedly, it can help with allergies. Drinking or applying urine is said to help with allergies by strengthening your immune system. kind of like re-exposing you to whatever potentially you ingested or whatever. It can help with arthritis. Drinking it or applying it directly to the arthritic area is said to relieve the symptoms of arthritis and joint pain or stiffness. I don't know if that has to be if it's cold urine or warm urine. Maybe if it was warm urine straight out the teat, then maybe maybe
is that where urine
help.
comes out from? Jeez,
that's a different problem. Yeah, so constipation.
That's a different therapy.
Yeah. Constipation, drinking urine is said to help with constipation. Coughs and colds, drinking it as well will boost your immune system and help fight off infections. Depression,
hey,
supposedly
nothing will lift your spirits like drinking some urine.
Drinking urine, or applying it topically to your entire body can promote a sense of well-being and reduce stress.
Oh.
Diabetes as well.
Hey, man, it's a cure-all.
Headaches and migraines, drinking it or applying it topically can help reduce inflammation and provide pain relief. Heart disease is claimed to help, as well as high blood pressure.
Wow.
So
does anybody do this today?
Yeah. There are people actually
that's like not a fetish thing. It's like actually people.
No. So remember that TV show that it was like weird something, like the lady that could only eat cheesy potatoes or
My Strange Addiction or something.
Yeah,
like
My
that?
Strange Addiction.
Yeah.
Right. So there was this one lady on there that I saw this one time. She had an addiction to urine. And basically, she had cups of urine all over the place.
Oh, gosh.
And she would brush her teeth with urine. She would gargle with urine. She would just dip her toothbrush in the pee, in her own pee, and brush her teeth with it. And she'd bathe with it. She would do everything with it because she really believed that it was like, it comes out of my body. It's, it's supposed to be, used for me to use to help, cleanse, and it's sterile and blah, 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 blah. So, yes, there are people that still do this today. And it's interesting because in kind of ancient times, or even not so incredibly ancient times, there was an occupation of basically like urine tasters,
really?
Right? That could taste somebody's urine and they could potentially diagnose you. Oh, maybe if it was too sweet, that you have this issue or you have that issue,
sugar in your diet,
or whatever else.
Like
yeah.
that, yeah.
And so,
that's interesting. Yeah. Well, I imagine you would be able to tell that. You take a vitamin B or C supplement, and it drastically changes the what your urine is. So I imagine you'd be able to taste that difference.
Yeah. Or man, you've been eating too much asparagus.
Yeah. You've been hitting up that Taco Bell way too much.
Yeah. Dude, whenever I eat Honey Nut Cheerios, my pee smells terrible.
Oh gosh.
I don't know why. It's so weird. It's
Honey
just
Nut
like
Cheerios, dude.
So I don't know. Urine therapy. I just thought it was kind of an interesting therapy. But
all right, so the one that I have next is called grounding therapy. Have you heard of this?
I have. Yeah.
So the theory is that grounding or earthing is what it's also called, is a therapeutic technique that focuses on realigning your electrical energy by reconnecting to the earth. There's a little research behind grounding, but smaller studies have kind of reported benefits of inflammation, pain, mood, and more. So the studies are extremely small, like 10 people or like less. The central theory here basically is that the grounding affects your living matrix, which is this interconnector between living cells. So it's this electrical conductivity exists within the matrix that functions as an immune system defense, similar to antioxidants. These folks who would do this believe that through grounding, the natural defenses of the body can be restored through the vibrations and electrical energy from the earth or from the trees nearby or from the grass. So the effects of grounding are interesting. So there have been a couple studies. So there was one study that was examined the role of grounding on post-exercise muscle damage. The researchers used both grounding patches and mats. So these are different ways that you can ground. Basically, it's just like a mat with aluminum foil or something like that that's then wired out to some kind of a spike that's in the ground. So you're technically grounded. And they measured the creatine kinase. I'm not sure what that is. White blood cells count and the pain level before and after grounding. So the blood work indicated that grounding reduced muscle damage and pain in participants. This suggests that grounding may have health benefits or healing abilities. There was another research study done that showed that grounding for pain reduction and mood improvement. So 16 massage therapists, 16 is a small number, but they altered between periods of grounding and no grounding, like while they were doing their work. Before grounding therapy, physical and emotional stress and pain were common side effects of their physically demanding jobs. After the earthing therapy, pain, stress, depression, and fatigue were all reduced among participants. So, like massage therapists are very physical with their hands, and they're standing up and they're bent over. So it's a kind of an exhausting job. So It's interesting that they saw a marked decrease in that, but it was only 16% participants, so hardly statistically significant. So some of the things it's supposed to do is chronic fatigue. The massage therapist said that they had a decreased levels of fatigue, chronic pain, that the grounding helped them reduce the amount of pain, and just generally anxiety and depression. Supposedly it was shown that even 1 hour of grounding therapy can significantly improve your mood. And then sleep disorders. It said that grounding can help you with your sleep. Some people actually put grounding mats in their bed. They say while they're sleeping, they ground themselves and it makes them just rejuvenate better. And also cardiovascular disease. So before you go to bed, ground yourself and drink your pee.
Yeah, you have a healthy heart.
A couple ways to do it. Walking outside, exposing your skin to grass. Whether that's your feet, the soles of your feet, palms of your hands, or just laying out on the grass or in the sand at the beach. Who goes to the beach and puts his feet in the sand and feels miserable? Nobody does. So it's just like that grounding effect is like what. There's almost like this euphoric thing that they say comes out when you are just in touch with nature. Now, concrete doesn't count. You got to be with your skin in touch with grass or the ground, the dirt, sand. They also have grounding mats, grounding sheets, grounding blankets, grounding socks, grounding bands and patches. So there's like a variety of different things that they do. But if you think about it, from our bodies are kind of like batteries, and they have an electrical charge to them. So if you call it, you can call that chi, you can call it just your electrical charge, but we do have it. And you think about when you're playing on the trampoline with your kids, and then you ground yourself on that metal, there's a shock. And so it's interesting. You think about, do we ground ourselves outside? Do we resync up the electrical vibrations in our body? Maybe that's something we need to consider more. So that's grounding.
Yeah, I have seen and heard of people, they'll put these grounding pads in their beds, and then that it'll attach a wire to it that'll go off the side of their bed and then up and out their window that will be connected to a copper pipe or a copper spike that's pounded into the ground 6 feet or whatever.
Yeah.
But I mean, I think that's definitely true. I think grounding yourself, even if it's just not for, I guess, being in nature and relaxation type, but I could see that.
Hey, so after your workout, get home, walk around the yard for a little bit in your bare feet, and then jump in your sauna, and then go upstairs and take a cold shower, and then drink some pee. Boom, that's your morning routine.
Yeah, that's true. Or you live somewhere where you live by a creek, and so you get in the sauna, and then you get out of the sauna, walk down the yard down to the cold creek, and then jump in the creek. And
there you
come
go.
back.
Yeah.
Yeah, that's interesting. I had a couple of kind of I guess the modern day ones that I had researched was, and these are just kind of interesting therapies, and maybe these are more considered kind of holistic therapies as compared to like just medical therapies. Um, but cupping,
Mhm.
that is a therapy that's kind of popular, but does it really do a whole lot? I don't know. I remember the one Olympics where like all the swimmers had all these cupping bruises and everything
Yeah.
else, and it's like, what the heck is that?
Hey man,
Okay.
Michael Phelps won several Olympic golds doing
Hey,
that.
and I'm not saying that these don't work. Another one, acupuncture, um, reflexology is kind of massaging certain points on the feet or the hands that correspond with other parts of the body. Aromatherapy, that one has been mentioned a couple times. Hypnotherapy, and another one that's kind of new-ish is kind of cryotherapy,
Oh yeah.
exposing the body to very cold temperatures. This kind of improves circulation. I think this can kind of be compared to also just cold exposure therapy. Um,
Mm-hmm.
and so those are kind of all some modern ones that I thought were interesting. The last one that I had, and I'm gonna kind of join these two together, but was electroshock therapy
Oh geez.
and the lobotomy.
Yeah.
So electroshock therapy, I thought was actually kind of interesting. It's a medical treatment that uses or that is used to treat certain mental illnesses, such as depression, bipolar, schizophrenia. Basically, it involves applying electrical currents to the brain to induce seizures, which are believed to help reset the brain's function and improve the symptoms of whatever mental illness you have. Um,
Is there actually any science behind that, or is it just like a way for them to torture people under this like antiquated idea that it resets your brain when you basically shock the living heck out of someone?
so I thought that was just like a torture technique for insane asylums in like
Yeah.
the 60s and 70s.
You're gonna regret saying that to me. I'm the
Yeah,
warden of this place. Send her to
yeah,
shock therapy.
but it actually is something that's still done today.
No way.
And so typically it's administered under general anesthesia. A muscle relaxant is given to minimize any kind of discomfort or anything. The patient is unconscious during the procedure, so they do not experience any specific pain. But then the electrical currents are applied to the scalp through electrodes, and they induce a seizure in the person. And basically, those electrodes are placed on both temples, and it shocks that person's brain. They have a seizure, and then after they have that seizure, it is thought that it helps to kind of reset the brain.
Hmm.
It
Well,
has been used for over
yeah.
70 years and is still today considered a viable treatment option for certain mental health conditions.
Interesting. That's
Yeah.
crazy. Does it?
So
Yeah. Interesting.
it is considered kind of a last resort over other treatments. And it really kind of with the invention of modern medications and psychotherapy meds and everything else, it's not as common, but it obviously has benefits and risks. So the second one is the lobotomy, and this one is it's now largely discredited in upon the surgical community, and it was once used to treat basically mental illnesses similarly to the electroshock therapy, like schizophrenia, major depression, mania, manic depression, whatever you want to call it. And it would involve cutting or scraping away parts of the frontal lobe of the brain. And this was thought to that after that it would affect the person's mood and behavior and personality. It would help alter that. And so if they were super depressed, they would there's a couple different ways of doing it, but a lot of times they would take basically like an ice pick looking thing, a sharp metal thing, and they would put it kind of in the corner of your eye and push it up through kind of your orbital
cavity,
into where your brain was, and then they would kind of damage that frontal lobe to change your personality. And hopefully, and this is where it kind of breaks down, hopefully the change that they're making is going to make you happier.
Oh gosh,
right?
yeah.
But it's just like there's no way to like pinpoint.
We're
going to do like,
you'd be happy when
yeah,
you're
if you push right here, it makes you happy. If you push right here, it makes you sad. It's just like, hey, let's just go in there and just push things around and see what happens. So they were first performed in the 1930s and were used throughout the 40s and 50s, but they were discredited in the 60s and really just kind of completely fell away after antipsychotic medication and other treatments came to light. So now lobotomies are considered just a brutal and inhumane treatment, and are rarely, if ever, performed for any reason today. So
Yeah.
I just thought that one was kind of interesting therapy that was used that was almost like, I mean, who thought that was, I don't know. It was kind of one of those ethical things, right? Are you going to put your kid in front of the TV and, you put 20 kids in front of the TV, a foot from the TV, and then 20, 10 feet from the TV and see if it hurts their eyes over 20 years? That's not really an ethical study because you're putting people at risk.
Yeah.
This is like, oh, hey, we think that the frontal lobe affects your personality and your mood. Let's just friggin' stick something in there and poke it and see if that makes you feel different and see if that cures you. I mean,
well, I think, dude, in the 40s and 50s,
trial and error with it.
In the 40s and 50s, dude, there was unethical stuff going on across the board, man. The Nazis were doing unethical stuff. The Japanese were doing unethical stuff. Even the Americans were doing unethical stuff. In fact, there was recently some documents that were released that the government was doing some experiments on people, testing stuff on people that were unbeknownst. And they were like, if this gets out, people are going to think we're just as bad as the Germans, so we can't let this get out. And, now we're learning about it just now. And like, dude, they were doing experiments on people just like the Nazis were. And in some ways, just as bad. And so sometimes there's no ethical. And you think about like how those insane asylums really were in the 60s and 70s and how all that was exposed about how horrible the conditions were there. And then that led to them shutting that entire program down. So pretty crazy. I mean, that's worth a whole episode in itself about how all that happened,
Yeah, for sure. So, I think all these therapies are interesting. I think some of them are backed in science, and some of them are backed in maybe just experience and trial and error. And some of them are probably just friggin' superstition that has nothing to do with anything. And if they help anything, it's just from self-fulfilling prophecy or placebo effect.
Yeah. Another one that I just kind of had off the top of that I just kind of think is interesting, but I didn't really look into it much, is binaural beats. You ever heard of that?
No.
So it's basically like the frequencies of sound that you can play different frequencies of sound through headphones, like both ears, and it will generate like different feelings of sadness or gladness, or even like the feeling of being on drugs or the feeling of being on whatever. And so I've kind of tried it a little bit, didn't feel anything. But allegedly, I was watching this one video where a guy was saying that when he was in high school, him and all of his buddies were doing binaural beats and like almost like it was a drug. And
really?
His whole high school was doing it. And they were like, yo,
playing it over the intercom.
Yeah, these teenagers are doing drugs and stuff. And like, they're playing these sounds in their ears and it's causing them to, go crazy and all this kind of stuff. And apparently there was one girl that like did this like one like super depression binaural beats, and she got so depressed that she killed herself, and it became like this huge headline about like teenagers and these dangerous online sounds that they're listening to, and like the sound that can kill your child tonight on the news, and it's just like,
I think I actually do remember that.
Yeah. So binaural beats, it's pretty interesting. There's different frequencies that can make you feel supposedly different ways. And so you can go find a chart. I mean, you can just YouTube binaural beats, happy, sad, cocaine, or, whatever. And it'll have a beat that you listen to, and it's just kind of like, it's just kind of like a pulsing hum, like, or it depends on the frequency, obviously, that, supposed to make you feel something.
Interesting.
So,
Well, what I'll say is that none of this is medical advice. We are not medical professionals. This is all for entertainment purposes only. So,
except for the part about drinking your own urine, that was medical advice.
yeah, please do that and
Let us know.
Call us and let us know how it went.
Yeah. So anyway, and then the last one I was thinking of is some of these guys in the gym. They're eating like antler fuzz.
Deer antler velvet.
Velvet. Yeah. Have you heard of this?
Yeah, I actually took deer antler velvet.
What'd you think?
So basically what it is the whole theory behind it, and I think it's a load of crock, but basically deer, they during the season, right? So deer every year they'll lose their antlers and they'll fall off. And then every season they'll grow a new set of antlers. And these antlers grow super, super fast. I mean, it's like in one season, you can have like a whole deer grow this massive rack of antlers. And when antlers first grow, they're not like the bone feeling antlers that you have. Basically, they're covered with this kind of velvety, like a furry type substance. And it's called, antler velvet is what they call it. Well, the whole theory behind it is that so the male deer have these antlers, and during the time that they're growing these antlers is kind of like during kind of the end of the beginning of rut season and all this sort of kind of stuff. And so there's just massive amounts of testosterone in their system. And that is what helps these antlers to grow as fast and as big as they do. And so there's a whole bunch of theories about how they use this deer antler velvet is kind of where a lot of this these nutrients and everything from this leftover testosterone or everything resides. So they would harvest that, and then they would put it in pill form, and you could take it. It's kind of like you can take bull testicles. They sell powdered bull testicles, and a lot of people will take that because there's a whole theory. I guess it's a whole therapy too. Can't remember what it's called, but it's basically like if you ingest the organ of another animal, then that will help improve your own organ. So if I eat, deer heart, it's going to help my cardiovascular health. If I ingest Rocky Mountain oysters, bull testicles, then it's going to help my testicles, and I'm going to produce more testosterone. So that's kind of a whole kind of belief thing. But in college, I took deer antler velvet for a while. It was just kind of pill forms. And I mean, I don't know if it really did anything. It didn't sterilize me, so that's good.
Hey, that's good.
I wouldn't say that I got jacked from it, but I was kind of doing it as I was working out, and it was kind of similar to a lot of other just like natural quote unquote testosterone boosters.
Yeah.
But
well, cool, man. Well, this has been a great episode about a lot of interesting different theories. Maybe go try some of these. Maybe some of them don't try. But there's science is ever evolving. It's a practice. It's not a exact science. And so, just think about when there's the story about the guy who discovered like bacteria, right? And he was, I don't know if you know that story, but there was a hospital, and there was all these babies that kept dying. Infant mortality rate was super high in the hospital, and this guy was trying to figure out why. And he finally determined that the doctors, when they were down in the morgue, they wouldn't wash their hands when they came upstairs to deliver babies. And so he started having people wash their hands, and the infant mortality rate went down. And so he started like
significantly.
yeah, so he went around and was saying, hey, like this is germs, like this germ theory, and they absolutely like destroy. I mean, they're like, you're crazy, you're nuts. I think they put him in an insane asylum, and he eventually was like put in jail or died because he was off the wall insane. That he was saying that that the doctor's hands could be dirty, and so it's you know, I don't think that that type of mentality still exists today, and I think in some ways where it's just like, oh well, the doctors can't be wrong, you know. The doctor says I should take the Pfizer shot. I'm taking the Pfizer shot. It's healthy, right? So,
hey, who knows? Maybe in the future we will all be wearing grounding shoes.
Hey, maybe so. Maybe so. That's actually one thing is they're saying people wearing tennis shoes, they're not grounding, and that's why we're having so many health problems because the shoes prevent them from grounding. Maybe that's a good business idea. Ground yourself.
Fauci lied to everybody, but that's a different story.
That's a different episode.
Yeah.
Well,
all right.
Yeah. Well, everybody, thanks for joining, and let's build that creed together.
All right, let's do it.